Ladies and gentlemen, are you AI or are you real? Who's, I mean, are you real people? I am. So thank you very much. We are really grateful that you took the time to join our session. My name is Elizabeth Migwala. I work for a company called Qualcomm. Has anybody heard of the company called Qualcomm? Few, yeah. So Qualcomm is a technology company, and I'm going to say powering mobile revolution, redefining connected processing, enabling intelligent computing everywhere. It's a mouthful. So if you're using connecting on the internet globally and using a mobile device, you're likely to be using Qualcomm technology. I think that's still pretty abstract because you don't buy anything that is branded Qualcomm. So, however, the four participants you see here are a product of some initiatives that Qualcomm has undertaken that takes that mouthful and makes it really tangible. Okay? So today, you're going to see three demonstrations of AI in real life. People doing what they would have done, what they would have been doing the normal way, but using AI to do it better. And they are a product of two initiatives that we have. One of them is called Qualcomm for Good. It's our Tech for Good initiative. And what that initiative does is it works to bring the advanced wireless technologies to people and communities across the globe to strengthen economic and social development. So this initiative over 20 years has scaled over 160 programs in 75 countries, collaborating with more than 800 organizations. These are some of those organizations. The other initiative we have is Qualcomm Make in Africa, because for the longest time, our continent has been an adopter, a user of technology. We as a company came to the conclusion that it's about time that this continent begins to innovate and begins to create solutions that answer the challenges of the continent. So we came up with what is called Qualcomm Make in Africa. This is a program that a global mentorship program where we work with organizations to do exactly what they have been doing, but we bring in mentorship and technology so that African innovators create solutions for Africa's specific challenges. So by introduction, you will hear from three such organizations. Joyce Rugano from EcoReach Solutions. We have Dr. Alice Muhuhu from Aurora Health Systems and Esther Kimani from Pharma Lifeline Technologies. I'm going to leave the stage for them, and I guarantee you that it will be an interesting session. We'd like to make it interactive. Time may be against us, so once we've gotten through the three presentations or the three demonstrations, if time allows, we will discuss. Otherwise, they have a position on the exhibition floor downstairs. So over to you, our first presenter, and that will be Joyce. The floor is yours.
Hello. Thank you. So my name is Joyce. I am the founder at EcoRich Solutions. You can put the slides up. So maybe you're asking, where did this come from? Where did Wasteboard technology come from? So I grew up doing farming with my own parents, and I experienced firsthand the struggles my parents went through, that they couldn't get any yields from their farms. And this made us to live in extreme poverty, not enough food, even enough school fees for learning. And I got an opportunity to go to the university, and I decided I'm going to change their story. Their farms have to be productive. On the other hand,
I'm Robinson Irekwa. I am the head of research and development. I personally grew up in the largest slum in Nairobi called Kibera. And I saw how organic waste used to clog water streams and cause public health menace in such places, affecting especially children and pregnant women.
so we came together and we decided to close this loop. So we developed, assembled, and patented a technology called the Wastebot that is solar powered, AI enabled, that is able to convert any type of organic waste to nutrient-rich organic fertilizer within 24 hours. So this is a smart recycling bin that is mobile and automated, that allows you to put in any waste. Can be your home, can be a hotel, can be a school, can be an institution. You put in the waste and it's automatically converted to organic fertilizer within 24 hours.
And so how the wasteboard looks like, it has different chambers. We have the input chamber whereby you put your organic waste, and then we have the shredding unit that breaks down the organic waste further using microbial enzymes with the use of microorganisms to break down the organic waste. And then we have the last chamber, which is the output chamber, whereby you get your organic fertilizer out. So after that, actually, to dig deeper on how the wasteboard works, it works actually in 3 phases. The first phase is the activation of the microorganisms at 28 degrees centigrade. And then this goes to the thermophilic phase, whereby the temperature rises to 70 degrees centigrade, breaking down the organic waste into organic fertilizer, using only the beneficial microorganisms, activation while deactivating the pathogenic microorganisms. And then it cools down to 28 degrees centigrade, whereby the wastebot now you can be able to remove the organic fertilizer outside. So this is the Qualcomm technology that we embraced, the EC25 development kit that we integrated, that has really helped us in that has enabled connectivity between the wastebot systems, remote monitoring, and also real-time data transmission across our wastebot systems. So that has helped us to produce the new generation of the wastebots that we are having currently. So I will dig into 2 very important phases, or 2 important technological components, and that is the IoT sensor system that helps us to maintain a well-conducive temperature modification and also moisture and organic material composition. At the same time, we have also embraced AI that has helped us to smart automation of the heat regulation system that we have, and also the aeration cycle. At the same time, processing time has also been very effective using AI components.
So it's from this technology that we've made great impact in Kenya, from environmental, social, and even agricultural. From recycling over 4,000 tons of organic waste in Nairobi, we've served over 10,000 small-scale farmers who've increased their yields by more than 36%, and increased on our employment, women and youth empowerment.
So how is the wastebot relevant to the ICT4D conference? Actually, the integration of IT into the waste management sector has been effective, and this has created a digital platform for us to embrace information technology into the wastebot sector. And this has been initiated by the integration of the EC25 development kit that has really helped us to be where we are today.
So our vision is big, and we want to scale our technology across all the Kenyan cities and African cities. My dream is to walk to any institution, your home, and find our WasteBot in operation.
And through the Qualcomm Make in Africa program, we are so grateful to Qualcomm for enabling us to integrate the EC25 development kits. And this actually has shown us that innovation grows through partnership. And Qualcomm Make in Africa, which is actually now referred to as Tech for Good, has helped us accelerate our vision for smarter, scalable, climate-resilient waste management systems across Kenya, Africa, and to the rest of the world. Thank you.
Thank you.
Okay, Alice, I think the floor is yours. Yeah.
Okay. Good afternoon, everyone. I want to start off this presentation with a question. Should where you live influence the type of healthcare services that you can access? Well, this unfortunately is the reality for millions of Kenyans and millions of Africans. And when it comes to specific conditions like cardiovascular disease, which are time sensitive, geography becomes extremely crucial. So cardiovascular disease is the leading cause of death in the world, causing out of every 3 deaths, 1 out of 3 is accounted for cardiovascular disease. But in Africa, we always knew that this is a future projected condition that we would have to worry about later, but not anymore. It is already here. Cardiovascular disease is coming up as a rapidly emerging non-communicable disease, and actually it will take over from infectious diseases as the leading cause of death in sub-Saharan Africa in 3 years, according to WHO. So back to my question, should your geography affect the kind of health services you receive? Well, I have a number for you. If you were born in any European country, you have access to at least 800 cardiologists in your country. But in Kenya alone, which is one of the higher countries in Africa, by the way, we only have 35 actively practicing cardiologists. When you combine that together with difficulties in infrastructure and infrastructure gaps that are there and lack of sensitive and specific tools for this condition, it leads to the emerging crisis. So hello, my name is Dr. Alice Muhuhu. I am the founder of Aurora Health Systems. I'm a medical doctor by training. Our company is here to democratize access to cardiac health in sub-Saharan Africa and even globally. We have developed a wireless electrocardiogram device, which is what you're looking at. Our device is able to convert from being 3 leads to 6 leads, allowing us to capture over 35 different heart conditions. We have also paired this with artificial intelligence diagnostic support. I will now play a short demo of our technology. Yeah, thank you. But what we're doing is so much more than a device. We just from the clinics that we've worked with, we've already proven that through early detection, we have 80% faster detection of cardiac events through technology like this, 65% fewer hospitalizations, and 2 times higher survival rates. And these results are published by the Kenya Cardiac Society. Now, I wanted to talk about AI because so many people are talking about it, and I actually brought a demonstration. I just want to walk you through what the average clinician or nurse, because most times it's not usually a doctor doing this, and what ECG interpretation means. So ECG is actually printed out on a graph paper, and the graph paper is like this. I don't have an A4 paper, but it looks like this. It's printed continuously. Now, cardiac disease is interesting in that you can be completely okay in 1 minute, and in the next minute, you're not okay. So you need to continuously monitor people. So let's say with our device, we monitor people for 14 days continuously. We will generate 30 kilometers of this paper, and this is what is traditionally used. So I just wanted to give context. So through artificial intelligence, we annotate different sections of artificial intelligence is able to annotate when the event is happening for those 14 days. So you can imagine how long this takes to interpret. And yeah, so artificial intelligence has done so much for healthcare. That was just a brief example of what it does for ECG. But the conversation about AI is going on so much, even amongst the doctors. AI is great, but similar to pharmacological therapies that we offer patients, like I'll give an example, a Caucasian woman who has breast cancer compared to African woman with breast cancer use not completely different, but tailored pharmaceutical regimens. The dosage is different, the supportive regimen is different. So when you come and just bring AI, which is trained, which is not representative of African patients, you can use the same analogy. Artificial intelligence is very biased, and this is leading to either overdiagnosis, underdiagnosis, or even misdiagnosis. So I just want to put a number that's an error, but it's less than 1% of African data is contributing to healthcare artificial intelligence data sets. And given the fact that we're about to be a quarter of the world's population, 1% is terrible. Yeah, so our company, we do much more than a device. We contribute to artificial intelligence data sets, and we've worked with Qualcomm. They have Qualcomm AI Hub, which is great, which we've used to optimize some of our data sets. Yeah, but yeah, innovation is great, but means nothing without deployment, and that's where programs like the Qualcomm Make in Africa project have come in. They joined us last year to roll out a one-year project to scale in 100 clinics across East Africa. And Qualcomm's technology for edge computing is very interesting in that it has allowed us to upgrade our device. So our device can be used offline. We have a hybrid AI model where AI can be processed on device offline, and then when connectivity comes back, it can be sent to cloud. So that means it can work in any clinic without electricity or any internet connection. Yeah, so just on a general impact level, we're also working to contribute to the overall WHO goal, which is the SDG 3.4, which is to lower non-communicable diseases by 1/3 by 2030. In terms of sustainability, we have a business model where we actually do revenue sharing with the clinics. So not only are we benefiting the patients, but we also offer clinics an opportunity to generate revenue. And this cost-efficient model that we have is supporting like it helps us be sustainable in terms of business for Pathway to scale. I just want to end by saying this. Yeah, technology is great, early diagnosis, smarter health systems, but I want to end with this quote. The future is here, true, but it's just not evenly distributed. And I urge you to join our company in making cardiac diagnostics accessible across Africa. Thank you.
Thank you, thank you, thank you, Alice. And our third presenter, the floor is yours, Esther.
Thank you so much for the opportunity. I'll also begin with a video. I felt like you wanted to clap. It's okay to clap after using AI to also demonstrate that the work that we are doing with smallholder farmers. So I think I would also begin with the question, why I do what I do. And seeing me here today, I'd like to take you back a couple of years ago. I'm still a youth, but I grew up doing farming with my dad. That's me and my dad on the farm. I'm born here in Kenya, in Nyandarua, and we were planting, I believe should be peas. I'm sure my dad would wonder why I can't remember. But it was quite sad to see the devastating effects of pests and diseases, as alluded to earlier. It is from this farm that we got educated. It is from this farm that our health care was taken care of. It is from this farm that a dress for Christmas would actually come by. And sadly, we got to see almost half of our produce destroyed in every season due to delayed identification of pests and diseases. So I was reporting to the university in a purple dress. And on this day, I knew that I was actually leaving home to change home, and home in this case being marginalized farming communities, such as the one that I grew up in. And why this matters is because if currently we are losing almost half of the food produced, the graph is showing us that without immediate intervention, by mid-century, we could be losing 3/4 of the food produced to pests and diseases. Now, smallholder farmers, in a bid to find a solution, excessively use synthetic fertilizers and farm chemicals, emitting up to 9.8 billion tons of carbon annually, and that's about 24% of the total greenhouse emitted. To put this into context, compare this with emissions from the transport sector and burning of the fossil fuel combined. Now, you can imagine agricultural sector actually surpassing the two industries if immediate action is not taken. And why this matters to us now, look at Africa. When we are losing maize worth $2.5 billion to $6.2 billion, and we are still talking of hunger. In East Africa recently, we had the drought locust invasion, and we lost crop worth $8.5 billion. In Nigeria, tomatoes were not spared by the tuta absoluta. And in South Asia, we are talking about India, Pakistan, Bangladesh. We have the mango hopper and the fruit fly infestation. So you can ask yourselves, sorry for that, I don't know why that happened, why the problem has existed for so long. And it's because farmers have had to rely on their own intuition and guesswork, agronomists that charge $60 per visit, and drone that charge $100 per hour to fly over farms. So with that background in tech and meeting an able team, that's why we thought of a solution that's not only affordable, but also giving timely detection of the pests and diseases required. And so this is an example of an image on a farm. And this is a device that has been mounted. It is scanning crops on a radius of 900 meters. And once a pest or disease is identified on any of these crops, the respective farmer receives a simple SMS on the mobile phone on the pest or disease that has been detected and recommendations of what they should apply and the exact quantities and oncoming climate risks so that we reduce the shocks on these smallholder farmers. Now, they only pay a subscription fee of $3 a month. So we are not only making AI affordable, but democratizing it so that even rural communities can actually afford it. Now, why are we here? Last year, we had the privilege of being selected out of the many startups in Africa through the Qualcomm Make in Africa program. In this program, we were able to train our own models. Now, previously, we were paying for models to detect the pests and diseases. But through this program, we were actually mentored and had very good experts while we were able to train our own models to an accuracy of 88 to 97% detection of the pests and diseases. And we are now using Qualcomm Edge AI processors to enable real time. So previously, the devices would have to send images for processing and then send the recommendation to the farmer. Now, each one of our devices is doing on-farm diagnosis, meaning even the diagnosis is even faster. Our goal is to impact 1 million smallholder farmers by 2030. And we are not just building devices. Farmer Lifeline is building an infrastructure where we are going to empower these farmers right from when they plant, detecting pests and diseases, and linking them to even markets where they can sell their goods at even good and better prices as opposed to the local markets that they have. So join us today on this journey as we impact smallholder farmers. Thank you.
So, ladies and gentlemen, I have to admit this is not, I'm not a practitioner in this environment, but I'm an engineer. Okay, so I work the technology, but just two comments. I think, first of all, sitting among these people humbles me because I think it's what we said. What is technology? The technology they mentioned without them. I think that's the first thing. And the second thing is we talked about African innovators creating solutions for the challenges we just saw. Honestly, if you told me that we were talking AI for a waste management system, that would never have occurred to me. But how about somebody who is what we've just seen? So my parting shots before, if we have any time for questions, is that this is really what technology should be doing. This is what AI should be doing. It's not about going on the internet and using what somebody else has developed. It's about doing what they were doing this. She was always a doctor, a cardiologist before this. This makes her a better one. She was doing the work she was doing without technology, but this makes it better. She was also doing the same thing without technology, but this makes it better. So is this AI for life, for development? I just want to really give them a hand of applause because really it's and just to say that what they've discussed, I think, is on display. That you can hear more about it on the shop floor downstairs. And I see I have 29 seconds. Is it 29 seconds only that we have? In that 29 seconds, oh, we have question and answer. 10 minutes question and answer. So any questions, you can direct them to them specifically, please. Have the mics go around.
I'm Mitra Ardram from Frugal IoT, and we do low-cost IoT solutions. And I'm interested in what it costs you to add these, the IoT component to what you're doing. Because I've seen projects similar, but without that component. So I'm wondering what it costs you to add, and does that enable the kind of solutions you want, or was that pricing them in or out?
Take 2 or 3 together and get questions. Second question.
So my question is to Farmer Lifeline Technology, and I want to ask specific about the challenge of the resources involved. What challenges has farmer faced being able to pay the $3 per month? Is it effective, or what are the challenges? Thank you.
Thank you. My name is Paul. I work for Clear Global. I've heard that the data that is currently available for building solutions for cardiovascular diseases is biased if it exists, and you gave a figure that is really lower than 1%, you said. What do we need to do to improve that situation, to improve that the level of data available, so that AI can then be made better over time? Thank you.
Over to you to answer the questions.
Yes, I think I can start with his question. So the integration of the IoT sensors into the wastebot system truly assisted us in meeting some components that we never used to. And it actually met some of the targets that we had actually set. So like, for example, number 1 is on emission savings. So instead of using a third party to come and do the emissions measurement or do the emission analysis, integration of some of these IoT sensors that actually can be able to measure the methane emissions, carbon emissions, we have actually integrated into the new system of the waste bots that has actually helped us not to rely on a third party to come and do the same for us. So by just doing that, we can get the data just from the waste bot system, and that has really cut the cost of using a third party to do the same. Yes. Yeah, it actually raises the price of the waste bot machine, to say, but it has that benefit on the other side. Okay, like around $800, yes.
I'll answer the second question, but also answer the first question as well. Our product is experiential. By that, I mean a farmer has to see the benefit of the device before paying for it. And when you're talking about a smallholder farmer, they've invested labor, there's the input cost. And so whatever you're bringing on the table must show value. And it took us some time to get to the $3. We started with a subscription fee of $1 a month, just because it's a smallholder farmer, but it didn't make sense to us as a business. We would as well just close and go back home. So we did a feasibility study with a Canadian NGO. We sampled 2,000 random smallholder farmers who are not only growing for subsistence, but had a little surplus for sale. And they looked at they took the data of before using the technology, how much were they earning before using the technology, and after using it, how much yield were they able to increase, how much were they able to reduce in terms of losses. And when they saw the results, were they willing to part with only $3 from whatever they made? And that gave us a starting point that if you were able to guarantee an increase in their yields and reduction in their losses, then $3 was not hard for them to part with. But on top of that, we needed to find value for the data that is collected from smallholder farmers, because anytime you're mentioning AI, data is included. So we had to be transparent with them. This is the kind of data that we have on the size of your farm, what you've planted, what have your harvests been like, and we'll be sharing this also with credit, insurance, and loans, so that you can also benefit from your own data at only $3 a month. And that began making sense even for a larger number of farmers. So there was transparency, and there was also the fact that there was impact when they saw the use of the device as opposed to previously. Now, the device costed about $70 before integrating the new technology. It's now ranging between $150 to $200. However, by integrating that technology, it has enabled us to increase the scanning radius of the camera. From the demonstration, I know now you understand when I say the scanning radius, from 900 meters to 1,200 meters. Do auto rotation, meaning one device is able to serve more farmers. So I'm able to earn more revenue from the same device. So integration of the technology did come at a cost, but it's also benefiting us on the other side as business. Thank you.
I'm going to answer your question and the question about cardiovascular disease. And first, I'll piggyback off of her answer. We will also had to increase the cost of our device from $300 to $500. And like she said, we're able to earn more revenue because of the technology and the software as a service. Like, we're able to increase certain things that we can monetize off of this and increase our revenue in as much as we increase the cost of the hardware. And I also want to mention, which I think will tie in with his answer, because of the way, I'll just use ChatGPT for an example. The more information you feed ChatGPT about your own personal information, the more tailored the responses are to you. And that's what it's like in healthcare. the more healthcare data we can get, the more personalized we can have it for African patients and prove increase in outcome, right? Like they've been able to do with pharma and genomic studies. It's still a lot of research is still going on. But another way we've been able to cushion the cost of increasing like IoT and edge technology, we have been able to collect better quality data, and that has allowed different partners to come in and cushion some things. Like, for example, we have a partnership with the University of Oxford that is interested in cardiac data. So they're running researches with us, and that helps us cushion some of the costs of this. In terms of cardiovascular collection of cardiovascular data, it's extremely important. Like I told you, less than 1% of that data is coming from African patients. And like I mentioned, we're going to be a quarter of the world's population. I think this is what happens sometimes when I'm just going to maybe blame doctors, when we just kind of don't participate in technology conversations and we let everyone create it and we kind of just adopt it without giving any feedback, and also patients, right? I think by involving more doctors and patients, more people are getting to understand that the more data I contribute, the more it will personalize my care. I'll use the example of smartwatches. Many people are using that, and people have kind of started learning, especially some of the patients who are working within the clinics, that the more data is collected, the more personalized our treatment would be. So there's a lot of customer education, lots of education that needs to be done in the medical community around this topic. There's an issue of data sovereignty that's going on. When you talk about healthcare, all the governments are now engaging in long conversations about data leaving the country. 98% of healthcare data from Africa leaves the continent. So there's so much to be done. I think the conversation about data sovereignty is a sensitive topic, but yeah, I hope I answered your question.
I think we have only 7 seconds. And I think we finished on time. But again, thank you. And thank you for being such an exceptional audience. We can continue our conversations over the next few days, and you can have more time to discuss with our panelists. So thanks again, and have a good afternoon.
So you have 30 minutes to your next session.